Hello everyone. Welcome to the June 2025 edition of Health Recovery Services Presents. I'm your host, Reggie Robinson. June is Men's Health Month. This month is all about encouraging all of us guys to take care of ourselves by eating right, exercising, and paying attention to our mental wellness. The official symbol for this month is a blue ribbon, and the purpose of Men's Health Month is to heighten the awareness of preventable health problems and encourage early detection and treatment of diseases, including cancer, heart disease, and depression. This year's 2025 Men's Health Month theme is centered on closing the empathy gap in men's health through advocacy, awareness, and action. The empathy gap refers to the lack of care, funding, and support for men's issues, including physical and emotional well-being. Men's challenges are often overlooked, leading to fewer resources, delayed care, and limited awareness. While awareness and funding efforts have successfully addressed numerous other health challenges over the years, men's health issues receive significantly less attention despite statistics demonstrating clear concern. Men die 6 years earlier than women due to preventable health issues. Prostate cancer and testicular cancer receive far less media attention than other cancers. Suicide rates among men are significantly higher, yet mental health initiatives often fail to acknowledge interventions that resonate with men. Therefore, Men's Health Month is part of an ongoing international effort to educate men, boys, and their families about receiving regular disease prevention screenings and living healthier lifestyles. Men's Health Network, which established Men's Health Month in 1994, has been a champion of efforts to persuade the public to recognize the mental and physical health needs of men and boys, while encouraging fathers to be role models for their children through preventive health screenings, healthy living, and seeking help when needed. A special note about men and suicide. Rates of male depression and suicide have risen dramatically in recent years. The Ohio Suicide Prevention Foundation states that more than 80% of suicide deaths in Ohio in 2021 were among males. According to the American Foundation for Suicide Prevention, men are almost 4 times more likely to die by suicide than women, and more than 6 million men in the United States experience symptoms of depression every year. Despite these sobering statistics, a recent survey revealed that 49% of men felt more depressed than they admitted to the people in their lives. Perceptions of weakness, about requiring therapy, fears of social disapproval, and cultural factors are some of the main barriers inhibiting men from seeking mental health assistance. Men with depression often are not diagnosed for several reasons, including failure to recognize depression, downplaying signs and symptoms, reluctance to discuss depression symptoms, and resistance to mental health treatment. We urge men and others to notice the warning signs of depression. According to Families for Depression Awareness, signs of adult depression, which are changes from how the person usually is functioning, may include talking very negatively or expressing hopelessness, acting without concern for others, abusing alcohol or other drugs, withdrawing from family and friends, problems concentrating, making decisions, or remembering, talking suddenly about separation or divorce, complaining of physical aches and pains, eating too little or too much, and sleeping too much or too little. Listen, everyone faces challenges and obstacles in life that can knock you down, but some difficulties can weigh heavier than others and become a mental illness. If you begin to notice some of the previously listed warning signs in yourself or others, it might be time to get professional help. Organizations like Heads Up Guys offer free online depression self-check tools to help you identify warning signs. Local resources are also available for men and all others in our communities who need them. Health Recovery Services has been a trusted community behavioral health care resource for 50 years. You can contact us for assistance in your mental health journey. Our website is www.hrs.org, or you can call us at 740-592-6720. Our outpatient treatment sites across southeastern Ohio offer highly qualified professionals with expertise in behavioral health treatment, including substance use disorders. And our residential centers, Bassett House and the Rural Women's Recovery Program, have consistently been recognized for excellence. Finally, it's vital that all of us speak up and fight against stigma for the mental health of the men in our lives. Mental health is important, and we should all be able to talk about it when we're facing difficult moments in life. Here are a couple of ways to support Men's Health Month. Wear blue every Friday in June to show support. Use hashtag #ShowUsYourBlue and hashtag #WearBlue on social media. Together, we can close the empathy gap and create a future where men's health is a shared priority. Well, just like that, we've reached the end of our program. Please like and share this video, and if you've not yet subscribed to our YouTube channel, please do so. And while you're at it, please follow Health Recovery Services on Facebook. Thank you so much for watching. We'll see you next time on HRS Presents.
Hi, I'm Joe Conrad, founder of Man Therapy. In 2012, our agency was asked to take on the issue of suicide among working-age men. And I have to admit, I thought we had met our match. Was it possible for a website or an ad campaign to positively impact such a complex and serious issue like suicide? And our strategy from day one was to go way upstream. We always believed that the best defense was a good offense, and so we wanted to connect with men long before they were in crisis and really let them know that therapy is approachable to them and it's something that they could do on their own terms. From day one, we set out with 4 primary objectives. The first one was to break through stigma and make therapy more realistic, more accessible to more men. Secondly, we wanted to improve help-seeking behavior, to encourage men to become more aware of their situation and to take charge of their mental health. Third, we wanted to reduce suicidal ideation in working-age men, and a CDC-sponsored study that took place in the state of Michigan has proven that we've done exactly that. And then finally, we always wanted to connect men to the right resource at the right time so they could take action on their own personal mental health journey. Every day, thousands of men turn to Man Therapy looking for information, answers, inspiration, and resources that can help them on their journey. Like Dr. Rich Mahogany said, taking care of your mental health is the manliest thing a man can do. Thank you so much for the important work you do. We look forward to working with you.